Good afternoon and welcome. Thank you so much for joining us today and spending time with us learning about the Physician MBA program at the top-ranked Kelley School of Business here at Indiana University. My name is Susanna Eastwick. I serve as the director of the Physician MBA program. Of course, I'm joined in the room here by Felicia Morris, who is our student services coordinator and admissions coordinator. You'll see her in the chat and on the Q&A, and our awesome AV team is behind the scenes. And we're excited to spend some time telling you about the Kelley Physician MBA program. Now, I like to start by always saying, okay, you can find lots of MBA programs all across the US and abroad. Why an MBA for physicians? There's only a handful of MBA for physicians, and we are the only top-ranked business school offering one. Where for us, what we see is that the constant change that is happening across the healthcare industry needs the physician leadership voice behind it. You are the ones who best understand patient care, and we'd like to see you serving in the leadership roles, driving effective change. And the challenge is, as you can agree, you don't necessarily have the language and the tools to navigate the business challenges that are happening, especially given that business and medicine are no longer or never have been exclusive. So tools, things like marketing, delivery, finance, teamwork, leadership, etc., are what we offer. And so this program was designed decades ago. We've always partnered with the faculty in the IU School of Medicine here, which is the largest medical school in the U.S. based on enrollment. And so our faculty have been teaching and working alongside of physicians, teaching business acumen and leadership concepts for decades now. And it really is our mission that we are trying to change healthcare through physician leadership. So, of course, why the Kelley School of Business? Well, we are one of the top-ranked business schools in the U.S. We are consistently, and have been consistently for more than a decade now, been the #1 ranked online MBA. And why do I share that? Because with this program, we're 70% online, 30% in person. And so you can study online with us with great confidence, knowing we are the leader and the expert at delivering business content in an online environment. We also share the rankings because why is it important that we're ranked? That means that you get a certain quality of faculty in our classroom, you get a certain quality of student. There is an excellence around the concepts that we teach, our delivery model, etc. It's important to us that we maintain that excellence that we see in the rankings that we're recognized for. And that faculty ranking really comes to bear within our Physician MBA program. What's unique about our business school, and you're here actually on the Indianapolis campus, people who know Indiana University, the Kelley schools are both on the Bloomington and the Indianapolis campus. Here on the Indianapolis campus, our faculty are actually often doing joint research or appointments or consulting work with our colleagues in the School of Medicine, but also with the many healthcare companies that are headquartered here in Indianapolis, which include Lilly, Roche, Cook, Humana, or Anthem. There's a number of that have their headquarters here. And so what's unique about our faculty is they are very much understanding the healthcare industry, but even more so, they understand your learning style. There's studies that have been done that talk about how you effectively teach physicians CMEs for long-term retention of knowledge and practicing physicians. And what they've found is if you leverage the physician learning style, which is first recognize what you already know, then introduce the new knowledge, have you reflect or apply that knowledge, and then reflect on it, that increases the retention of knowledge. And so our entire program is built around that learning experience. You'll see that in our modality from online to in-person. You see that in how we build the topics throughout. But our faculty really understand that's how you learn, and that's how they build their content to ensure that you get the most learning efficacy. Additionally, they understand you're going to be giving up your most precious commodity when you go back and get your MBA, and that is your time. And so for them, they very much think about how do they teach you the best practices through efficiency and effectiveness to be respectful of that time. They also know how to leverage best practices for a really immersive, both online and in-person experience. Here's a great quote from one of our alums, Dr. Summer Liston Crandall, who graduated in 2024. She's at a small rural hospital in Michigan and actually heading into a top leadership role eventually. Her quote here, "I enrolled in this program because I want to make healthcare work better and know how to navigate our complex system. Learning alongside other physician leaders and from faculty who've taught physicians from the start really makes the Kelley Physician MBA stand out. Whether learning process improvement, economics, or finance, we can apply everything to the healthcare setting. And that's a great way to sort of walk into our curriculum today. So what we see ourselves doing is giving you an MBA. We have what's called a core MBA. So this isn't an executive MBA, actually, because we're not focused on time to completion. We're focused on the breadth and depth of what you need to know, but we deliver it executive style. So if you hear that executive MBA word thrown around, that's typically a lower credit hour, the faster time to completion. So for us, our MBA is a standard MBA. And actually in the first year of the curriculum, you complete a standard Kelley core curriculum. So Kelley has a brand of our MBA where we teach a standard curriculum of marketing, finance, management, accounting, and so forth. And so in the first year of the curriculum, you're going to be taking that core curriculum. And then the second year is when we've designed a series of customized courses that really focus in on the intersection of business and medicine and what physicians most need to know. And ultimately, throughout all of our courses, what we're studying is not just how the healthcare industry currently works, but how it should work. And what we do is we take best practices from all industries and then teach you how to apply them to the healthcare industry so that ultimately you're walking away with, okay, wait, if manufacturing's figured this out and banking's figured this out, if we take some of these concepts now, humans are not widgets, but if we take some of the concepts, we can use that to revolutionize the healthcare industry. And one of the unique things we do is if you're like, oh my gosh, I don't know about finance, I'm not a math person, great. We always pair quantitative courses with qualitative courses. So we use both sides of the brain and make you feel quite comfortable and confident as you work through the curriculum. Now, one of the things we really specialize in is problem-based learning, because if you recall, going back to the physician learning style, we really recognize the best way for you to learn is in that application model of learning. And so as you go through the program, we're going to be asking you to do projects, typically projects from your organization or one of your team members' organization. You're on study teams of 4 to 5 physicians, and you change teams every 6 months throughout the program to expand that learning and networking component that an MBA is really well known for. You also do consulting projects with outside organizations. We're constantly bringing in expert speakers and panelists to talk to you about, okay, here's how it's really working now. We use the case-based method primarily for most theoretical concepts, and it's a very experiential classroom, which you hear this word experiential if you have kids who are in their college search. All colleges are talking about experiential learning. And what that means is really we immerse you in the conversation. When you come here to Indianapolis or to DC, our classroom is always very much focused on, okay, let's take you to the courthouse and talk about how the healthcare law is adjudicated. Let's go to a manufacturing facility and look at Six Sigma in practice. So it's very immersive in ensuring that you learn this language well. Now, our whole program is designed for physicians, not just the curriculum, but the modality. You come in with the same cohort and take all your courses together. There aren't electives because we learned early on that sort of creates like FOMO and everybody's like, I need all of the courses. So we've created all of them. And you take all the courses in a lockstep curriculum. And it's a like-minded individual. I was talking with someone yesterday about how, you come into the program speaking the same language of clinical medicine, and then you learn this language of business together. We use the team-based peer learning. It's very flexible and very efficient. And so we think about how do we use your time effectively. Now, I mentioned our applied learning component. We actually have courses that are specifically honing in on that applied learning. One being our executive coaching. We actually immerse you at the very beginning in a leadership course that really looks at how you lead yourself, lead your team, lead your organization. And at the end of that week, you're paired with your executive coach who then walks alongside you for the duration of the program, looking at how you're going to be taking the lessons that you're gaining from the program to really enhance yourself from both a personal leadership or an organizational leadership perspective. And you can find the profiles of all of our coaches on our website to see all their different areas, but we only use coaches with terminal degrees who are certified coaches. We also offer the opportunity to go abroad and look at healthcare outside the U.S. We're heading to Australia and New Zealand in February of next year. We were just in Spain and Portugal this year. We're looking at going back to Europe in 2027, and that's optional, but it's open to all students and our alumni, and so you can continue to take advantage of that course for years to come. We also go to Washington, D.C. and immerse you in the conversation of healthcare policy, and really what we study there is how the physician voice can better be inserted in the experience. And we were just there last week, which was unique in these current times with the government shutdown. But it actually was one of the most powerful learning experiences, since there's so much conversation around healthcare policy right now as part of the shutdown. It was just made for, not necessarily preferential, but it made for a great living classroom experience. We'll also end the program with a capstone experience. Capstone sort of is that word, when you're building a chimney, you get the blocks and then you put the cap on the top of it. And so the capstone experience is really taking your entire curriculum and everything you've learned, and you do an individual project at the end of the program where you take everything you've learned and write out, your pro forma business plan, what have you, on a concept that you want to move forward in some capacity. And so it's very individualized. So if you're interested in entrepreneurship or operations or looking at quality, what have you, you can use that as your capstone experience to really personalize the curriculum. We also offer a course in career management and professional development, as well as dedicated career coaching. And throughout it all, you earn CME credits, which I'm going to talk about here briefly here soon, about how that can really be leveraged. But that's one of the ways in which we think about efficiency. Your CME credits actually post to your transcript every quarter. And before I move forward, I want to pause for a second and say I forgot to introduce our alumni guest as I was welcoming all of you, and that's Dr. James Dunlap, who just graduated. And I thought of him; he just went to DC in May, actually, because we've switched around our curriculum recently. So I'm sure he'll be talking about that experience as well. So he'll be joining us in just a few moments as I continue walking through some nuts and bolts of the program. So as we move forward, I wanted to highlight this quote from Dr. Sonal Desai, who's actually a presidential management fellow. If you look that up, it's a program that allows for management fellowship into government roles, and she's moving into a healthcare policy role. So currently is a fellow at a hospital in Texas in preparation for that. Her quote here: "Everything we learned in the Physician MBA program was an opportunity for immediate application in my work. The goal of the Physician MBA is to teach us how to use new skills and skill sets, and our goal is to apply them. The added value of attending a top-tier program is that you learn from professors and colleagues from diverse backgrounds, levels of leadership and expertise who help you build your foundational business skills." And so that's sort of just affirmation of everything I was just saying. Now, there's a bit of an eye chart here on the screen, and this is our program of study. I've emailed it to each of you ahead of this session to give you a sense of these are the courses, this is the dates that you take them, here's when our breaks are, here's when our residencies are. This is our document that really organizes everything. So we hold classes, you take about 2 classes at a time for 11 weeks at a time with a 1-week break in between, and there are 7 quarters in the program. And you can find a description of every course on our website. And you can find the faculty profiles of who's teaching every course also on our website. So this document is very helpful. And one of the things I always recommend is if you're looking at a number of different MBA programs, take this document and their equivalent document and sort of highlight these are the courses that most apply to what you're looking to learn. And by doing that, you'll see what program best meets your needs. And we typically win that game because you're going to see that there are courses in our program that are not found in any MBA program. And in fact, we've kind of borrowed them from MHA programs and MPH programs. So that's Masters in Healthcare Administration and Masters in Public Healthcare Policy, because we're really looking at what you most need to know as a physician moving forward. And so we have a very unique customized curriculum as a result. So I mentioned already the flexibility that we offer the program specifically to physicians. So the way that the program works is it's, as I mentioned, 70% online, 30% in person. The in-person component, you come here to Indianapolis once every 3 months for a 3-day class session. That is Thursday, Friday, Saturday. So most of our physicians fly in on Wednesday, fly back out on Saturday evening. Your workload you can expect, and this is a great conversation to talk with Dr. Dunlap or James. We're actually all on a first name basis in our community, or else we trip over titles all the days. But also we try to really create a strong community here, which is why we're a first name basis. But the workload you can expect in the online component is about 10 to 14 hours a week, and that's mostly asynchronous. Our faculty will lead class sessions every Tuesday and Wednesday at 8 p.m. Eastern. But if you're not able to log in live, they're recorded. You can watch them at your own convenience at a time that works for you. And we'll be spending that time doing reading, a lot of reading, of course, case studies, online discussions, your team meetings, your project analysis, etc. And there's typically something due every week. However, our faculty always stay 2 weeks ahead of you, at least in the courses, so that you can work ahead in the program easily. It's great for if you're sort of on a week on, week off kind of schedule. You can do most of the coursework on your week off. Or if you have admin time, you can schedule it for then. You can still take family vacations, go to conferences, etc. You just have to manage your assignments accordingly. So a typical cohort for us, we typically see somewhere between 40 and 45 physicians in a cohort, lots of different states and specialties represented. We'll see an average age around 45. Now keep that in mind, that's an average, right? And then we'll see about 35 to 40 different specialties. So you might be like, oh, that's a homogenous group of MDDO. No, we'll pull in physicians from every single practice environment you can think of, pharma, device, payer side, you name it. So it's a very rich, diverse cohort that drives the conversation. And here's a great quote from Sachi Hiramath, who graduated in 2023, who's a system VP at Advocate Midwest. His quote, "The best part of the Kelley Physician MBA program is working and learning alongside physician peers, which is missing in a fully online program. Zoom can't replace three-dimensional human interaction." And I love that quote because that's really very much Sachi. He was well known in his cohort as one of the leaders. And I believe Felicia's put his profile into the chat if you want to follow along and read more about the alumni that I keep bringing up. So before I turn us over to James, I just want to walk through a couple more housekeeping details to make sure we're all on the same page. So in terms of program costs, when you pay to us, your tuition and fees cover a lot more than simply class. It covers all your instruction, technology, all of your student experience. We feed you and offer you snacks while you're here on campus. It covers your executive coaching, your career coaching. We also have a lecture series and webinar series. We do networking events when you're here on campus or in DC that are covered, as well as primers. You don't have to walk in knowing anything. We're going to help get you from ground zero forward. So we'll do a primer on Microsoft Excel and Canvas, and we're looking at adding a primer on AI, since that's so important that everybody understand how to leverage that. And then, of course, it also covers all your CMEs. So it's rather comprehensive. And the program cost over the 21 months is about $96,000, and you do want to add to that from your distance from Indianapolis in order for your travel costs. And just to make sure we're all on the same page, the average cost of an executive MBA program here in the Midwest is about $168,000. So we are priced well below our market, and that is because we recognize most physicians are going to be paying this out of pocket. You've had deferred income, lowered investment opportunity, et cetera, due to your training. And so we've priced ourselves true to our mission, and that our mission is that we're trying to change healthcare through physician leadership. So if you look at the other top-ranked schools and are like, wait, why are you guys priced so low? Is there something wrong here? And it is not. It is that this is very much part of our mission to change healthcare through physician leadership. Now, in terms of how you pay, there are lots of different payment plans that you can take advantage of. We do offer limited fellowships or scholarships that assist with travel costs for those physicians who are joining us from a significant distance. You can leverage financial aid, which is typically loans. If you haven't exceeded your lifetime capacity for loans, for borrowing, you can use loans. They're about 6.8% interest right now, and you don't start payments until 6 months after graduation. And then I always say, the second you're thinking about an MBA, talk to your employer employer. Most of them have a tuition reimbursement program. It's about $5,250 each year. And so if you multiply that over, we fall over 3 calendar years, so you can use 3 years of that. And then additionally, because we award CMEs, you can reroute your CME dollars to get reimbursed for tuition in the program, which is another great way that we function in that sort of physician specialty. And if you're in a private practice or a private group, that actually means then the entire cost of the program is tax deductible for you, which is hugely beneficial. So keep that in mind. Now, in terms of our admission, we are accepting applications right now. We accept applications through the 1st of July or until the cohort is full, which we cap our cohorts at 50, whichever one comes first. So I'm always really encouraging that if you know this is an option for you, you want to apply early before we close the cohort. And our admissions requirements here on the screen, it's very straightforward. No standardized exams. You give us a form, a fee, your medical school transcript, your CV, and 3 people who can recommend you. And once we do an interview with you, you get a decision back from us within a week. And so it is very much focused on your time and being effective with your time. So on that note, I'd like to turn it over to Dr. James Dunlap, who graduated from our program just in May. He's the newly anointed Vice President for Premier Physician Network, overseeing the system operations and the orthopedic service line. James, thank you so much for being here and sharing your perspective. I'll turn it over to you to talk about your experience.
All right. Hi, everybody. And thanks, Susanna. I appreciate that introduction. I'm really glad to be here today in support of Kelley School of Business, the Physician MBA program, because it's done so much for me. But just a little background on myself. My name is James Dunlap, and I'm an orthopedic spine surgeon by training. And now I serve as the Vice President of System Operations and Service Line for Orthopedics at Premier Health in Dayton, Ohio. I just started this role about 4 weeks ago. I graduated from Kelley in the spring and took on a transitional role and then applied for this position and now I'm doing it. So like many of you, I reached a point in my career where I started to ask, what's next? You know, after years in clinical practice and military leadership, I found myself wanting to have a broader impact, not just on a single patient at a time, but on how entire teams and systems deliver care. I had reached this point where I just didn't know what was the next step. How do I get to that next role? And a friend of mine who was also in the military with me had gone through Kelley. And as we were talking, he said, you need to go to Kelley. You'll know what the next step is once you go there. I knew I wanted to do leadership within the healthcare system. I just didn't have the language. I just didn't have the knowledge, and I didn't know how to take that next step. And he was right. So when I started the Physician MBA program, I thought I'd be learning accounting, finance, operations, everything you would expect. And of course I did. But what I didn't expect was how quickly I could apply it. Within the first few months, I was already using what I learned to improve OR scheduling. I was able to analyze performance gaps in our spine program and negotiate vendor contracts that ended up saving our system millions of dollars a year. But just as valuable was the leadership coaching. The program helped me shift from this command and control style that's pretty typical in the military to a more collaborative approach, one that builds trust and influence rather than relying on authority. And that's really been transformative in how I lead today in this new role. And then, of course, there's the cohort that you'll be with, the relationships that I built with physicians from across the country, surgeons, anesthesiologists, internists, radiologists, hospitalists, all of them. They have been one of the best parts of my experience. You learn as much from your classmates as you do from the professors. So if you're here today wondering whether an MBA is worth the time and effort, I'd say this: it gave me the language, the tools, and the confidence to bridge the clinical and administrative worlds. I can now walk into a meeting with our CFOs and COOs and translate financial and operational data into what it means for our patients and physicians and vice versa. So that's a little bit about my journey. I'm happy to share more about what I learned and what courses had the biggest impact and how the Kelley experience continues to shape my work every day. So that's a bit of an opening here, and I'm going to go through. Susanna prepared me well on what would be helpful to talk about. So just to kind of go through this here, and I've got a timer for myself here just so I don't get too long-winded. But why did I choose Kelley? I mentioned that I was at crossroads after a long Air Force and surgical career, and I wanted to expand my impact beyond the OR into leadership and operations. And a really good friend of mine was attending Kelley while we were both in the military, and he did that in preparation for him to start a private practice once he left the military. And so he really encouraged me to apply, and I'm really glad that I did. I realized that I'd spent my career optimizing operating rooms, but Kelley gave me the tools now to really work at a system level. As far as what did the program teach me, what I'll tell you this is that, in the areas of finance and operations, for example, I learned to interpret P&Ls, and tie those clinical decisions to financial outcomes. In my transitional role with my new organization, I was able to identify an $11 million performance gap, right, in their performance. And we looked at direct variable costs, and specifically supply costs and length of stay, and how that impacted their contribution margin. I'll tell you, for our health system, just to share very quickly, we've had a negative operating margin for over a decade. So coming into this health system, they were already in the middle of significant positive change. So I didn't have this impact on it, but I hope to continue this momentum. This is the first year we're going to finish with a positive operating margin. And a lot of that has to do with some of the cost-cutting measures we've done, but I will tell you, it's about changing the culture and how I speak to our physicians and teaching them about their own P&Ls. We talk to them about their contribution margins, and sometimes that gives them a false sense of how much they're contributing to the system. We talk about that specifically because that's what's in their control. But what I think about too is when you have your take-home pay and the direct variable costs, that's what you decide to spend on, going out to eat, maybe the clothing that you have, but there's the other costs that you have to pay for every month, right? Your mortgage, your utilities, and so forth. And so those are those other allocated costs. And so for them to really kind of understand how they play a role in the system, I really brought it down to the individual operating margin for each physician. And I'm talking specifically about our surgeons here. And once I was able to get them to understand that, they started having different conversations amongst each other about what cost-effective care looks like. And it's starting to make a really big impact on how our physicians interact within the health system. Moving on here, leadership and change management. These leadership assessments and the coaching that you get, for me specifically, they really refined my active listening and negotiation skills, as well as my conflict resolution skills. So for example, today, I have another presentation later to a very large independent group that we want to develop a stronger relationship with, collaborate. And, I needed to understand, what did they value, right? One of the things I learned from our negotiation classes, understand what they value and what do you value, and then how do you put that together, and how do you make it mutually beneficial? So for example, I know for them, they really value expanding their real estate portfolio. For us, it's about reliable hand call coverage, for example. And then how do we make that relationship sticky? How do we get into a relationship where it's a win-win for both sides? And that's to integrate them even more so into our health system. I'll let you know how that presentation goes later today. From strategy and innovation, these courses really taught me how to connect daily operations to the long-term organizational goals. Right now, I'm leading an orthopedic strategy. We're coming together to build institutes where we have different services under an institute model. And, I just started this role in October. And of course, my institute's the first kickoff in January. So it's a lot of work behind the scenes trying to align folks. We're becoming a true academic medical center. We've been a community health system for a long time and had an affiliation with our local medical school, but now We're really coming together and becoming a true academic medical center. This is going to be a multi-year process, but it's very exciting to see it starting to come together. One of the things I wanted to say here, this is a quote from my experience. The biggest myth about physicians in business school is that we can't learn a new language. Well, as all of you out there can attest to, we are lifelong learners, right? When you're in clinical practice, you're constantly learning, you're constantly improving, and that's no different here. You'll go into the classroom and it'll all come back to you. Yes, it's going to be some new language, but all of you are intelligent, and you're going to be able to learn this material, and you're going to be able to apply it right away. The cohort experience, that was one of the most valuable parts, right? It was really the people. I want to bring up one of my classmates, Dr. Sasha Demos. She's an anesthesiologist. She was chief of the medical staff. She held some important positions and roles, but she was very interested in pivoting into biopharma, right? I mean, out of clinical practice. And it was something that she and I had discussed during our time there. There's always this worry about pivoting and changing and doing something new. But we both encouraged each other to keep moving forward. And Susanna would probably tell you that she doesn't recommend doing this right in the middle of the program, but Sasha did take that plunge, and now she is in biopharma and doing some amazing things there. So just somebody that I'm really proud to be associated with, and who had the courage to take on this new role. There is a diversity of perspectives there. That's what makes it great. Yes, we're all physicians, but we all come from different backgrounds, hospitalists, surgeons, but some are private practice owners. Some are from the military like myself, and just getting that diversity of experience together and knowing that we're going through the same process together made it really enjoyable. You start learning the moment you walk into residency week. Applying the MBA immediately. Using these Kelley frameworks, right away, I was able to start negotiating supply chain contracts, leading cost reduction initiatives, shaping governance structures. So Kelley doesn't just teach you the theory, they teach you how to apply it. And within weeks, you can start to take all of these lessons and go back to, your program and start having these discussions, whether it's finance and budget talks, operations and throughput redesign, or leadership and culture change. So my advice to prospective students out there is just be clear about your why. Are you trying to lead? Do you want to innovate? Are you looking to get into the entrepreneurial space? You want to build something new? If you want to influence how healthcare is delivered, not just how it's practiced, this program will equip you for that. And don't underestimate the relationships that you'll develop there. You're not just earning an MBA, you're joining a lifelong network there at Kelley, just with all Kelley alum, and more specifically with the physician leaders that go through this program. So just to kind of wrap it up here, the MBA, again, gave me the language and tools to connect clinical quality with operational and financial performance. It helped me shift to a leadership style that is collaborative and influence-based. I think naturally that's always been a part of me, but this really reinforced that. And it works a lot better, right? When you can start to talk to your colleagues, you have that credibility. But I'll tell you, we are in such a unique position where we can now sit in the same boardroom across from the CFO and the COO and speak their language while still representing physicians. So you now have credibility on both sides, right? And only physicians can really do that. They can go to their colleagues, and I've had so many one-on-ones with my colleagues, and I can tell them, I get it, I understand, and they know what I'm saying is true. But I'm able to explain things to them in a way that hopefully they can understand the why from the administrative side, and vice versa. That's really what I wanted to share today, and I'm happy to answer any additional questions.
Thanks, James. I just have to say, I love that understanding the why. We talk about that a lot. If you don't speak the language, right, and you don't have the reference point to have so much of that content that you just talked about gaining in the courses, then how do you understand the ways in which the decisions are being made that are affecting the sort of front line, shall we say. But it's the why. And this is why you do a program like this, so that you can understand the why.
Absolutely. And one of the things that excites me is I've started to give just primers on finance and operations to our physicians, and what I told them is, when you make your ask and you do it in a way that brings in the financial and operational perspectives, you're more likely to get that approved, right? Rather than that ask is, it feels like it's a what's in it for me perspective. And so you're exactly right, right? When we can teach the physicians, even on the front lines, like really understand the why and come at it from an organizational lens, and you're more likely, to see some positivity from the things that you're asking for.
Right. We talk about that, like when you put it in a pro forma and make the business argument over the clinical argument, because the challenge is the administrators that you're talking to don't speak clinical medicine, right? So you put it in their language and it works. Well, I want to open this up to any questions all of you might have who are watching and listening to us. At the bottom of your screen, we're using the webinar format. You don't have to turn on your camera or your microphone or anything. You just simply need to throw a question in our Q&A box, or you can use the chat function. Either one works to ask a question of either James or myself. I love the examples you gave, James, of some of your colleagues in the classroom. I know I don't ever recommend changing jobs while you're in the program. It's very stressful that people do it despite my best efforts. But can you talk a little bit about, are you still in touch? I mean, you graduated in May, obviously, where you got to be in DC together at the end, which is a different format than we use now. But can you talk a little bit about now how you're leveraging your alumni connections a few months out? Are you still chatting with your physicians from class? What's your relationship like?
No, that's a great question. So we do have a WhatsApp group, and that started during your time there at Kelley, and it sometimes is a very busy chat group. My phone goes off a lot. I have to sometimes set it to mute. No, but my point in saying that is that we chat a lot still, and what's great about it is that there's questions being asked of each other. Hey, I've got this issue. What do you guys think? How would you deal with it? Some of that comes up, but some of it is just sharing our everydays and happy birthdays, and that just is ongoing relationship building. And so I really appreciate the fact that we can stay connected. Now, talking about leveraging your network, I will tell you, for example, I'm dealing with our sports medicine physicians and their contracts and how they do collegiate athletic coverage. And I reached out to one of my classmates who is, and I'm proud to really say this, that he's the lead team physician for Indiana University football, and they're having such an amazing season. And I was able to reach out to him and say, hey, how does IU Health kind of handle these situations, in terms of contract and athletic coverage, and right. And he was able to share that with me. And, I've had other colleagues, that are, they're trying to get into new positions, and they're talking to me, okay, what were the steps that you took? And of course I would do anything that I could to help them in any way. But those are the types of things that just even within my class that we're talking about, and we're able to help each other. And of course there's the broader alumni network, right? And anytime we post on LinkedIn, and it's wonderful for everybody to share. I'm so excited to see when a Kelley alum, moves on and does something fantastic, and there's comments there, but that you can reach out to any of these alums at any point in time, and ask them questions and just connect with them.
Yeah. And our LinkedIn group is so much fun right now because there's so much passion and everybody's just so excited. And our alumni are very passionate about the program and what it's done for them. And so you can see that in there. Now, a question that we got from Dr. Lancaster, let's talk time commitment. Let's walk through the reality. How did you balance your job? You were in a job search sort of process, promotion process, your family commitments, all the things that you're active in. Let's break down, when did you actually do schoolwork? Were you a late night person, an early morning person? Paint the picture of how you manage this from a time perspective.
No, that's a great question. I think it's a really common question. So, the biggest key around all of this is communication, right? Making sure that this is something you communicated with your partner, with your family. Um, uh, my family knew the reason why I wanted to do this. What's the purpose of this investment? And uh, and so you do have to have some discussions about how you protect some of that time. And so for me, I had a very busy surgical schedule still. I was operating, I was seeing clinic. And so there was time set aside, of course, for synchronous learning online. And then, of course, times when you had to prepare for your deliverables. And really the biggest key is just making sure you set aside that time and just communicating that with your family, right? And there's got to be a balance there, and it's going to be different for everybody. Like Susanna said, it is about 10 to 15 hours. Some weeks are less. It's going to be maybe 5 hours, and then other weeks are going to be more, especially as the time leads up to that deliverable. You're working in groups, and I will tell you that it never works out perfect. And I've had a couple of situations where, for me personally, I had some personal family matters that popped up, and I couldn't contribute as much to my group at the time. I reached out to them, and they just took up the slack, and they said, "We got you. We're going to work on this." And when I was able to kind of come back to it, jump in, and then vice versa, it was no problem for some of our others. They're like, "Hey, I'm on call, and or I'm coming off call, and I just really can't join tonight." So we all understand that. So there's a lot of flexibility there. But I think, kind of to your point, Susanna, it's really communicating that and protecting that time, and just knowing what's the purpose of this investment. And if it's something that you really want to do, everybody figures it out. And for me, this was such an amazing program, and I was happy to really dive in, because I could just see its application immediately.
Yeah. So, how did you work? Like, did you do what I recommend doing, which is sort of firming in the schedule, putting it on your calendar,
Yes.
protecting it for when you had time, whether that be late morning, early evening? Is that how you organize the time?
That's how. So we have a family calendar, and so that's how I know what's going on. My wife puts things for our family, and from her standpoint, generally speaking, these are the non-negotiables. And so, right, so once I knew what those were from a family perspective, I fit in everything else. And you're exactly right. So I would put in my block time for when I needed to complete projects, or certain readings. And sometimes you have to use what's available out there to help you. So there's some programs, like I think it's called Listening AI. I don't make any money off of this, but you can plug in a PDF, right, of some of these cases that you have to read. And so, while you're driving to and from work, you can start to listen to these cases. So there's ways to optimize your time, basically. But you're exactly right. You do need to block that out.
Yeah, I love it. And we are actually looking at a primer that will teach a lot of that AI for how you leverage it. It's a careful dance, right? You don't,
Yes.
AI can hallucinate and make up sources. We all know the famous story of the lawyer that got disbarred, right, for trying to say cases that didn't exist. And that can happen so easily. We see it with students all the time. And so we really teach how to leverage that, but there's so much efficiency you can gain from leveraging technology. Another question, from Dr. Blackwell. He learns really well through group study. And so can you talk about the opportunities outside of the live sessions, the in-person sessions, that you can connect with others in the program? How did you stay connected when you weren't coming to residency? And what were even the live sessions like during the week?
Yeah. So I liked being connected to everybody as much as possible. So, I'm from is that right, Suzanne? I'm the last cohort where we met.
You are. You are.
And the nice thing about that is that, I got to see my classmates, often, and we enjoyed being around each other, but it limited the folks that could come to this program in terms of distance and just to come on a monthly basis just wasn't going to work long term. So I completely understand that. But so yes, learning in person is what I enjoy the most, but secondarily online, and we're interacting with each other with our professors, and they're so easy to talk to, and they kept it very interactive. It's not just giving a lecture. And so there was lots of conversation around the material. And then kind of to your point about how do we interact? I mean, for better or worse with COVID and getting on Zoom, a lot of Zoom sessions, right, together. And we would be in different parts of the country, different parts of the world. One of my classmates was in Italy at the time, or no, I'm sorry, Greece at the time, and were on a family trip, but we had a deliverable, and they took some time aside to kind of put in a few slides for their part of the presentation. So, so those are really great ways to get together. And then, of course, prior to residency, sometimes we would meet the that Wednesday night before. I mean, for us, it was the Thursday night before. But there's a lot of different opportunities to work together as a group for sure.
Yeah. And I've heard it's important to note we did change our modality from monthly to quarterly to have a better draw for time commitment, especially. But now in this quarterly setup, a lot of the groups have set weekly meetings where they just log on, and whoever can log on does, just to have a small conversation about, hey, how's that homework going? What do you think of the case? But even in the Zoom sessions, which are those Tuesdays and Wednesday nights, Nir Menachemi, who teaches, he's the dean of the School of Public Health, again, one of those classes we borrowed from Public Health, who teaches our entry course on anatomy and physiology of the healthcare system. He said his last class session the other night, I think it was 10:30 when they logged off, because they were just chatting and having a great time. So it definitely happens. So other questions before we wrap up here? I want to be sensitive to everyone's time. And again, so grateful for everybody's time as well. Any other questions that we can help answer? I have one last one, which James, you went to, was it London and Paris trip that you were on?
Spain and Portugal.
Spain and
The
Portugal.
last one. And then we were in Korea and Japan.
Korea and Japan. That's right. Yeah. I was like, I'm starting to lose track of everybody's trips. Can you talk about the value you experienced of the international component?
I wish so much that I can go on this Australia and New Zealand trip. It's just amazing, but with just my new role, it just wasn't feasible this year. So I'm hopeful for the following year. But these are amazing experiences for two reasons. One is that you get to spend this time with your classmates and with alum and with the professors that come along, and Susanna and the rest of the team there. And it's just such a nice time to spend together in a different country. And there is some, visiting parts of the country, but you're there to learn about their healthcare system. And Kelley sets up such an amazing program where you're going to, whether it's from a government official or the local medical school or, a hospital there. And you learn about how the good and the bad, right? And so we sometimes think that one particular place has the best healthcare system. So like for example, in Japan, healthcare, everybody gets free healthcare, but you kind of find out maybe some of the issues behind that, and how their length of stays are a lot longer than the rest of ours because there's no incentive. They're not incentivized to get patients out the door very quickly. In Korea, it's like the exact opposite. Efficiency is paramount, and honestly, they're some of the most innovative, especially in the orthopedic and spine space in terms of minimally invasive procedures, so that they can get patients out the door a little bit quicker. But so whether it's from the clinical aspects, it's from the policy aspects, you learn a lot, and you think about, how can we improve the U.S.'s healthcare system? I mean, it is a big system. It is a fragmented system. It's not easily solvable, but we have to start from somewhere, and these are just great experiences to learn from.
Yeah. And that's just an example. I mean, obviously it's optional, but it's an example of how there literally is no other program who's taking our physicians abroad and having these important conversations. And I'll never forget being in South Korea as the physicians were going on strike. Like
I know.
that was, I mean,
That was incredible.
proceeding for the system and lots of challenges they had to navigate. But from a learning perspective, really fascinating that we could be
Yes.
there in that moment and really understanding how their system works. So on that note, I want to thank you, James, for coming. Thank you for spending time with us. And I know you're in the thick of it as you navigate your new executive role. But so we're very grateful for the time you've spent talking with us about your experience in the program. And I'm equally grateful to those of you who joined us online today to learn more about the program and learn from James and his experience. Please keep the conversation going. Felicia's put in the chat here how you can get a hold of me. I'd love to continue to talk with you. Our goal, again, is changing healthcare through physician leadership. And we see this as a partnership. When we partner with you and you go out and do, just like James has done, this incredible, effective change, that's how we realize the mission of what we're doing here across the U.S. So thank you for your time today. Let us know how we can continue to support you.